But first, now you might have seen in the news that at just 16 years old, one British teenager has become the youngest boy in the country to have a gastric band fitted in order to lose weight. So, why has this drastic measure become so popular? Well, I'm joined now by three members of the same family who've all had a similar procedure, and they say it's changed their lives. And Dr. Hilary joins us as well. It's great to see you all, really good to see you. It's Zena, Nadia and Angela. And Zena, you had the op first, didn't you?
Yeah.
Yes. Now, so you had a bypass, did you?
Yeah, 2
Gastric
years ago.
bypass, 2 years ago. What weight were you 2 years ago?
I was 28.5 stone.
No.
Yeah.
28.5 stone, that's enormous.
Yeah.
That is there you are there. I can't, that looks to me like somebody about 3 times the age you are. It must be strange looking at that now, because that's not you anymore.
Feels like it was another person.
Yeah, well it was really,
Yeah.
wasn't it? So had you tried loads of other things to lose weight?
Yeah, I've been dieting since I was young because I've always been like big.
Sure.
And nothing ever worked.
So it's just like yo-yoing,
yeah,
dieting, then going
constantly.
Nightmare, absolute
yeah.
nightmare. So really, were you recommended this procedure, or how did you find out about it?
No, I watched like a few TV programmes.
Right.
And I was so upset with myself. I went on the internet and I just started researching it.
Right, because you knew you had to do something.
Yeah.
You knew you had to do something, and you tried, and it hadn't worked. So, Hilary, how does this work then, the bypass? What happens there?
The difference between a lap band and a bypass is that with a band, you're literally you're encircling the top of the stomach.
Right.
So you've got a very small pouch at the top of the stomach.
Okay.
And there's a little tiny gap through which the food will pass later on.
Right.
With a bypass, you're actually bypassing the lower end of the stomach completely.
Okay.
So you take that top pouch, you sew up or staple up the rest of the stomach away from that top pouch,
okay.
and then you use a loop of intestine to come from that top pouch in the stomach, bypassing the whole of the rest of the stomach and the small intestine. So not only do you only get a small volume of food able to fill that top pouch, but you're bypassing the intestine so you get less absorption of
I
the
see. That's pretty
calories.
serious, isn't it?
So
that's a serious
fairly major
operation
operation.
that you had, Zena. I mean, clearly it worked. I mean, look at you now. You look absolutely stunning. You look beautiful, very, very curvy and womanly and lovely. But when you eat now, you're full up really quickly? Is that what happens?
Yeah, I do. I have about a quarter of a plate of food and I'm full.
Right, and you're still healthy though. You're fine. You're still, and you won't get any thinner, presumably. This is what you should.
No, I've stabilised out at my weight now.
And that's what you're supposed to be.
Yeah.
That's your ideal weight, and you look lovely. Now, the thing is, so impressed by this was Mum Angela, that you decided to have the same op, or a slightly different procedure.
Gastric band fitted.
You had the band.
Yes.
And was that really because of your daughter?
Well, when Zena was on her diet, like after her operation, I started to put more weight on them, and then I went so far up that I was having lots of problems with my own joints.
Right.
And
so
my own health was going down, so I really needed to do something as well.
And again, you had tried other things as well,
Everything.
like all of us have done every diet under the sun, and and it wasn't working. That was you. Now, what sort of weight would you be there?
I was 20.5 stone.
Were you?
Yes.
20.5 stone?
Yeah.
What do you weigh now?
Now I weigh 15 stone.
Right, so you've lost a lot of weight as well.
Yes.
A lot of weight. Do you feel better?
Oh, fantastic.
Right.
Yeah, really good.
And this procedure is, you can take this out if you want, can you?
Well, you can, but not a lot of people do, really. There's no need to take it out.
Right.
I mean, I call it my small friend, so I wouldn't dream of taking it out.
Right. And the operation itself, was it fairly traumatic, or did you?
No, it was very easy.
Right.
It wasn't the same as Zena's. It was just so easy. One night stay in the hospital.
And that was that.
And then out the next day. A few days took to recover, and that was it. Very, very easy.
Well, Nadia, you've quite recently had the same operation as your mum.
Yeah, middle
So
of
you're
October.
still kind of losing right now. You're still losing right now. But obviously you see your sister, and that's a real inspiration to you. So you got the gastric band as well. You got the band fitted. What sort of weight have they told you that you might be eventually?
They've said I should lose about, I've lost 3 stone since the middle of October.
3 stone already? That's great.
And I'm hoping to lose another 4, so hopefully I'll be around about the 10 stone mark.
Right.
Something like that, hopefully.
So that's what you're hoping for, but it's a gradual process.
Yeah, it is.
Yeah, it's a gradual process. Okay. Hilary, now, obviously, this looks terrific. The girls look fantastic, you know, they all do, and Nadia's well on her way to losing her weight and becoming more fit, more healthy, more confident. But clearly this is it's quite a major operation, isn't it? It's not to be taken lightly.
No, absolutely. I mean, I think you have to exhaust all the other opportunities to lose weight, and I'm sure they did, and I'm sure they were adequately counselled. I think on the positive side, there's no question that this is a very successful operation. either one, the bypass
Sure.
or the banding. And it is said that in a year they will lose about 50% at least of their excess weight.
Right.
With the bypass, about 70%
Wow.
within a year of their excess weight. And then you carry on losing weight for up to 2 years, and then you should stabilise. You need counselling after the operation. It's not easily available on the NHS,
Right.
although NICE have suggested that we should make it more available.
Well, we've seen that. The government have said it should be offered
Sure,
to obese
but
children as
the
well.
reality is that hospitals can't really afford it.
No.
And it's going to be difficult to get those operations. I think that what I would say to people is that this is not an easy fix.
Yes, it's like it's not the shortcut.
There is a
all.
downside. I mean, there's no doubt that when you operate in any shape or form on people who are considerably overweight, there's a risk.
Right.
And there is a mortality. Some people die from these operations. If the bowel is perforated and people get peritonitis, it can lead to death in extreme circumstances. On the whole, it's pretty safe. And we also have to bear in mind that obesity itself, particularly morbid obesity, is associated with things that will kill you anyway.
Indeed.
Diabetes, high blood pressure, coronary heart disease, and some cancers. So you're treating things that will otherwise kill you. So a small risk is probably worthwhile. But it's not for everybody. I would like everybody to have exhausted all other possible means of losing weight first. And that would include strictly monitored sessions to exercise more, to look at lifestyle, healthy eating patterns, and medicines. There are medicines that can also help. But if you've done all that and you're still running the risk of ill health, then this is something that some people can consider.
Because, I mean, to be honest with you, Zena, the weight you were, over 28 stone, you were well on the way to an early grave, to be honest, weren't you? I mean,
I had liver problems, and my surgeon said I was weeks away from being a diabetic. So I'm much healthier now.
You are, and absolutely stunning. You look amazing. You really do. Congratulations to all of you. You'll continue to lose weight, and it's obviously worked for you, but as Hilary says, that there are risks. Thank you very much indeed. Right, it's competition